Welcome back to Health IQ. I'm Heidi Godman. President Obama just proclaimed that May is Mental Health Awareness Month, and with good reason. Listen to these numbers. Approximately 21 million American adults have depression. 21 million. 40 million people have anxiety disorders. 6 million have panic disorders. 7 million have post-traumatic stress disorder. The list goes on and on. But the amount of people walking around with these conditions who are undiagnosed is also well into the millions. So now two national groups, one called Mental Health America and another called M3 Information. These groups are encouraging people to do something about undiagnosed mental illness by taking a quick 3-minute test. And you can call or text your questions to us about it at 941-373-1220. 941-373-1220. Now, joining us to tell us all about it from New York is Dr. Gerald Hurowitz, an assistant clinical professor of psychiatry at Columbia University and a clinical psychopharmacologist. Dr. Hurowitz, thanks so much for being with us.
Oh, it's my pleasure, Heidi.
First, if you could explain to our viewers, or listeners rather, what is a psychopharmacologist?
Well, a psychopharmacologist is a psychiatrist who specializes in medication treatment. And whereas many individuals who need help with mental health issues don't necessarily need to be on medications. Someone like me has to be available to sort of specialize in that area for, in cases where it is necessary.
Okay. Now, before we talk about the screenings, why do you think so many people are walking around with undiagnosed mental illness?
Well, I'm sure most of your viewers are going to expect me to say the first thing, which is stigma. The people are somewhat embarrassed about having problems with their mood or anxiety. And so that almost certainly is one of the major impediments to getting more people to take treatment. But I think there are other subtler things. For example, a lot of people too often chalk up their emotional turmoil to sort of their life circumstances. And, of course, it's usual or normal to have our moods, affected by stress and unhappy events or stressful events, what have you. But there's a certain line that gets crossed where people are actually suffering from an illness. I could try to describe more about that in the next few questions. But I think people do sort of explain away their symptoms based basically on their stress level or their life circumstance.
Sure, absolutely. And you might have palpitations and you're thinking, oh, well, I'm going through a stressful time, and might not realize that there's a little bit more to it. What about misdiagnosis of mental illness? Is that also a problem?
It's a very big problem. When we got together at M3 Information to design WhatsMyM3, this, as you mentioned, this questionnaire, 27-item questionnaire, we knew that the within primary care, with your family doctor settings, there was an effort to sort of screen for depression going back, at least a decade or two. And we felt that the problem with that sort of screening approach was that not everyone who has emotional mood problems has a depression. There's lots of people who have anxiety. When you mentioned those numbers right up front, the gargantuan numbers of people who have depression is really impressive, but your listeners may have taken note that the number of people with anxiety disorders actually exceed the number with depression.
It's twice as much, yeah.
Exactly. And so we felt it was important to screen a little more broadly for anxiety and mood, depression and PTSD, and also to take a quick, survey of alcohol and substance use.
Why do you
those also factor in?
Why do you think that misdiagnosis occurs?
Well, primary care doctors especially, it's not always the case that people are diagnosed in their primary care office, but really the majority of people are. And in that setting, doctors, have a lot to contend with in terms of physical complaints and problems, and in the short time available to them, they have to be able to figure out, well, what's also wrong with this person's mood or anxiety. I mean, that's when the patient may complain about it. They may not complain about it. But in cases when they do, I often mention to medical groups when I speak to them that, I feel that doctors really don't need help so much finding depressed patients, because sometimes they do, but in many cases the person could say, I feel blue, I'm down. But it's these sort of mixed cases where people are anxious and depressed and angry, etc., where the doctors have a hard time sorting out the different sorts of disorders that might be causing the problem. So the M3, or WhatsMyM3, helps doctors to actually sort patients and diagnose them more properly. And there's one, if I may,
Sure.
there's one other very important issue here. Depression can occur in both sort of a normal, sort of what we call unipolar depression, where a person gets depressed and then after some time feels better and gets back to normal. And then there's a form of depression which is bipolar depression. And the important point here is that in bipolar depression, patients have periods of being high intermixed with being low. And that high period, you know, the patients usually don't complain about it unless it gets really out of hand. Often they feel terrific. And anyway, at the time they get to the doctor's office when the person's depressed, it may not at all be evident what sort of depression, which flavor of depression the person's suffering from. About a quarter of people who go to their doctors and have a depression end up being bipolar and not unipolar. And the important point there is they will then, if they're not diagnosed properly, get onto the wrong treatment. And when that happens, they can actually get sicker.
We are talking about mental illness. This is Health IQ with Heidi Godman. My guest today is Dr. Gerald Hurowitz from Columbia University, and we've been talking about how common depression and anxiety disorders are and all kinds of mental illness. But something we need to talk about now, Doctor, are the way that these things can lead to other physical problems. And do we know which comes first? Does mental illness come first, or does it and lead to the other physical problems, or do the physical problems set in first, which then leads to mental illness?
I would have to say that both occur. Most patients appreciate, most individuals appreciate that when they are physically ill and if they have a lot of stress at the same time, they may not do as well. Well, patients know that, for example, if they're diagnosed with something serious like cancer or heart disease, that it serves them to be in as good a mental state as they can be, because stresses make those conditions worse and it makes them more difficult to treat. But really, you can extend that same idea to just a myriad of medical problems: rheumatoid arthritis, osteoarthritis, high blood pressure, you name it, diabetes. There have been quite a number of studies showing that in all of these major diagnostic categories, physical diagnosis, that mental health symptoms can really worsen the course of those conditions. So it's a little bit of it is a true chicken and egg situation. Sometimes the medical problems worsen the psychiatric, and we know often the psychiatric and mental health problems worsen the physical. And
isn't inflammation a common denominator between some mental illness and the other physical problems?
Well, it's interesting. Inflammation, it turns out it's a little bit more technical question I think that we want to get into. However, I've personally held out inflammation as a wonderful analogy to what happens in mental illness. So this isn't strictly speaking an inflammation, but what I point out is that in a state of inflammation, what happens is inflammation is part of the normal healing process physically, and so in and of itself, it's not an illness. But inflammation occasionally, or pretty frequently, unfortunately, can go on and not sort of limit itself. It's supposed to last for a certain period of time, then go away as the tissue of the body heals. But it can often go on and not stop on its own, for example, and that's what happens in a lot of physical ailments like arthritis. And I said in many ways mood disorders are akin to that. Our moods are sort of designed to go up and down and fluctuate and respond to circumstances. It's really when a particular mood gets sort of stuck, it won't get out of that gear, and it's just very pervasive or more intense than usual, and in many ways that is akin to what happens in inflammation. Moods are part of our normal, natural life, and of course they're important, even negative moods like anger and anxiety, but when they get they no longer respond to sort of self-limits and to control, then we know we have a problem.
You talking about anger and mood swings makes me think of how mental illness also can affect people around you. Does that ever seem to motivate people to get a screening for mental illness?
Yeah, I would say so, yes. I think in many instances people are not fully aware, partially aware, let's say, of the ways in which their moods are affecting other people. I think the most typical thing might be someone's just grousing a lot or belly aching about this or that, and sometimes their friends feel a little worn out just trying to be a support. And, in those cases, occasionally people will think, well, maybe there's something else wrong with me, that I seem to always be in this particular frame of mind. And those folks can go to WhatsMyM3. It's a free website, by the way, WhatsMyM3.com, and also a free phone app, WhatsMyM3. And they can go there and take the screen on their own and get a sense of the likelihood that they may be suffering from one of these conditions.
Well, we are going to talk all about WhatsMyM3 and this free screening that you can take to monitor your own mental health. We are on WSRQ. This is HealthIQ. I'm Heidi Godman. Please stay with us. Thank you so much for being here with us today, Dr. Hurowitz.
Oh, it's been a pleasure. It's great. Thank you.
We've been talking about mental illness, and now there's this simple way to do a free self-check for mental illness. Can you tell us more? We've talked a little bit about it. WhatsMyM3 is the name of it. WhatsMyM3. What is that test?
Well, as I started to mention in the first segment, we at M3 Information, the makers of this screen, got together some several years back and wanted to really improve on mental health screening, essentially in primary care setting, but just sort of widely. And we thought it was a really good idea to widen the scope of the screen to include conditions other than just depression, anxiety, bipolar disorder, and PTSD. And I mentioned, too, some questions are included about alcohol and substance use. The important thing I think actually I want people to know is that M3 Information is sort of entirely privately funded, and we've gotten no funds from the pharmaceutical industry or any other large industry at all. And I think that's important because another thing that may keep people away from something like this is you'll see not too infrequently, you happen to mention that I'm a psychopharmacologist at the outset, people sometimes think, oh, this is just the big pharma's way of getting you to take more pills. We at M3 just really feel people need to take this sort of screen to get a sense of where they are in terms of their mental health. And it's absolutely does not promote, let's say, medication over psychotherapy. As much as I'm a psychopharmacologist, I'm a strong advocate for psychotherapy. And so the test does not push the patient or make recommendations in that sense in one direction or the other. But the test really is very simple. It's actually kind of almost fun to take, especially on an iPhone, because the questions queue through real sort of quickly. And they're very straightforward questions and easy to answer. And what they do at the end is they provide two things, in a sense. One, a single number that we sort of liken to sort of a person knowing their cholesterol. Their cholesterol number is something most of us know about now. We need to track it. And the M3 number, essentially it's any number 33 or higher, really seems to strongly suggest there may be a problem that warrants the scrutiny of a physician or a mental health clinician. We want people really to have some consciousness about this. In fact, recently there's the hashtag "What's Your Number" has been gaining some social media trending, and a lot of people are sort of taking the test and writing in the results and sharing their thoughts about it. And I think that's just really terrific. And
no, I want to mention. I'm sorry, but I want to mention the way that people can do this, because maybe as they're listening, they can even look at their phones. And if you're in your car, please pull over first to do that. But can you tell us how we could access it on a phone or on the website?
Sure. The smartphones, both the iPhone and the Android store, carry WhatsMyM3. It's a free app. And online, it's WhatsMyM3.com. And both are really simple and easy ways to access the screen.
So who in particular should be taking the screening? Veterans, students, everybody?
We think everybody should be taking it, yes. Again, just as all of us know, we're supposed to track our cholesterol and have a sense of where it is. We feel having a sense of this number, a mental health number, is really important for people to start to be aware of. And the nice thing about it is that the site that those two ways of accessing it we just referred to, those are entirely sort of self-contained and private. Nobody else, the results are not saved. It's only for your eyes. You certainly can have it sent to your doctor or record it or print it up or even email it if you like, but it's otherwise entirely private. There are ways through doctors' offices where, with your permission, a doctor can actually administer the test and track your results over time. And we think that's another really great advance over previous screens. This is something that would help doctors actually monitor your ongoing treatment. Again, psychotherapy or medication or both, or meditation or exercise, whatever a patient may choose or feels appropriate together with their doctor. It's a way to monitor their progress over time.
So the information is anonymous. Do you keep it? Do you get an account on the WhatsMyM3's site? Does it track it right there and keep it for you anonymously?
There's on there are ways. It's a little bit complicated question. There are ways on the website and slightly different ways through the phone app where you can have access to tracking it. But the sort of standard, sort of free version that we talked about doesn't involve automatic tracking. But it's something that can be done. Through physician's office, there's a website called called m3clinician.com, where doctors can provide a test, and it could be coordinated and tracked for the doctor and you in the doctor's office.
So the test seems pretty simple. How many questions did you say that there are?
There are 27 questions altogether.
So how can it be accurate?
Well, we did, actually I shouldn't say we, but a group at the University of North Carolina in 2009 to 2010 performed a study of primary care doctors down in their clinics, and they compared it to other standard tests for screening psychiatric illness, and they compared it to a gold standard, which is called the mini exam. And so the mini exam sort of is the sort of, as I said, the gold standard. It really kind of confirms or disconfirms the diagnosis. And what we found is that the M3 stacked up was equally as effective, sensitive, and specific in finding these disorders as 4 separate screens, one each for the different diagnoses. So we stacked up to the single screen for depression, the single screen for anxiety, etc. And it's not infallible, though. Again, to go back to the cholesterol analogy, when a person has a cholesterol, let's say 230, we know that's too high. It does not mean automatically that that person has cardiovascular disease or atherosclerosis, but it does mean you're at risk for it. And that's similar to the way the M3 should be interpreted. It's not saying black and white, yes, you have this condition. It's just saying, here's the likelihood that you have it, and you should have a further discussion with your clinician about it.
So when you get a 33 or higher on the test, what do you do with that number?
Well, what happens is that the test not only provides you with that one number, but it also breaks out those 4 different diagnostic groups, the depression, anxiety, PTSD, and bipolar, and it gives you some sense of where you may fall within those different 4 subcategories. And what we suggest, and what the website and the phone suggests, is that you take it to, if it's at that level, if it is above that 33, that you take it to a clinician and have a conversation about it. And printing up the results or having the results available at that clinician's office would be great, because not only do you want to look at the numbers, but you want to review the questions that you answered.
And what's the best way to seek treatment? Should you start with your primary care physician or go straight to a therapist?
Well, I think, people vary so widely in their access to mental health care and in their, sophistication and comfort with it. In wide sections of the country, it's probably easier for them and quickest to get themselves to their primary care doctors. In other areas, the patient might want to just, may be aware of a mental health clinic or a clinician in a neighborhood. And I would say any of these routes is okay, because the one reason, I guess, to go through one's doctor's office is that you want to rule out that there's some medical condition that may be playing a role in the mood or anxiety state. But any trained mental health clinician, even a non-MD, knows to be concerned about that too. So, however, whichever first step you take, most trained professionals know how to lead you from that point forward.
So this little free test can make a big difference for all of us, really, because mental health affects our society. And so if we can all get diagnosed, if we have any challenges that we're struggling with, it sounds like this really can make a big difference.
Oh, it absolutely can make a big difference, and we have some wonderful stories about people who had feelings of suicide, and we know suicide's been in the news recently with a report of high incidence of suicide in the what's the name of the group that I belong to? The baby boomers.
Yes, I'm in that group
who
too.
are also losing their memory a little bit. Anyway, the incidence of suicide's risen among baby boomers, and it's pretty alarming. We've already heard some really fabulous stories from people who say that they took the test, they heeded the warning, an alarm was raised because they had mentioned some thoughts and they either call the Suicide Hotline, which is immediately available on your phone if you want to access it. It's offered as an option in case that looks like it's a concern, or take yourself to see somebody quickly because it's so vital. And we've had a couple of really wonderful testimonials about that.
All right.
It's really fantastic.
Well, Dr. Gerald Hurowitz from Columbia University, thank you so much for joining us today to tell us all about What's My M3.
Well, I thank you for the opportunity to talk about this important issue.
All right.